infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, new research from the Companion Animal Parasite Council gives people and their healthcare providers a way to assess their risk for Lyme disease, thanks to man's best friend. The study confirms dogs are sentinels to assess human risk for tick-borne Lyme disease. And the study is published in the journal Geospatial Health. Well, joining me to discuss the research and its uses is Dr. Craig Pryor. Dr. Pryor is a board member and past president of the Companion Animal Parasite Council. From Australia, he's a practicing veterinarian in Nashville, Tennessee for over 25 years and currently consults with vets nationwide. Dr. Pryor, welcome to the show, sir.
G'day. Thank you for having me.
Now, the study quantifies the association between canine seroprevalence for Borrelia burgdorferi, the agent of Lyme disease, and the human incidence of Lyme, the most prevalent tick-borne disease in the United States. Dr. Pryor, can you briefly summarize the study for the audience?
So what we're using is canine data. We had over 4 million data points we're actually able to look at on a county level. And so looking at the seroprevalence in dogs and then looking at what's going on the human side, they're actually able to quantify that there is a direct relationship between canine seroprevalence and the incidence in humans as well. This was actually previously published by the CDC back in 2012, but the CDC actually found a cutoff at about 5%. We've got so many millions more data points now that they're actually able to take it a step further and just basically say pretty much any seroprevalence in dogs, it's the same percentage risk in humans now. And so there's a lot of mathematical models put into that, but it's been very, very enlightening work that they've done.
Now, there's several ways of estimating Lyme risk. So what are the advantages of using canine seroprevalence data over these other methods?
In dogs, we are routinely testing. It's just part of what we do. So it's, when you look at the human side, and I'm not a practicing medical doctor, but I do know that there's, things you're dealing with, HIPAA laws. So you got privacy rights, which we don't have to deal with dogs. And you also, a lot of doctors will only test if they absolutely think they've got someone sick from it, whereas we are doing routine screenings and we can publish our data. So we have just so much more access to data than they do on the human side that we're finding that this is actually where we're getting the advantage of being able to estimate the risk.
Yeah, and the research also shows that the human risk of Lyme is not just found in, say, Minnesota and Wisconsin and states of the Northeast. It's found in a lot of other areas. Can you elaborate on that?
Yes. Well, we're finding that a lot of what's going on is we're seeing, the deer population is expanding, its range is expanding, they're moving. We're seeing one of the mice that actually helps carry the ticks. Its range is moving as well. Migratory birds are moving. And so because of all this and weather changes, people living closer to nature, with, reforestation, things like this, we're seeing that these ticks, the black-legged tick, are basically moving into areas where they haven't been able to seen before. And so we're seeing a lot of this where it's what we just call it's kind of oozing down into new geographies. And so a lot of it's what's going on with mobile population, mobile wildlife, and what's going on with the reforestation, et cetera, and climate.
Now, a key is that the data allows the Companion Animal Parasite Council to publish these wonderful prevalence maps. Can you talk about that?
Yes. So we've got a number of sites. The prevalence maps can be found on two main sites. One is CAPC, that's CAPC Vet, so it's capcvet.org. Easy to remember is petsandparasites.org. That's the two main sites. You'll find our prevalence maps. and you can actually look at these prevalence maps down to the county level, and it will show you the prevalence in dogs at the county level, and you can now look at that and say, well, that's my risk if I'm living in that county or if I'm traveling into that county. So, it helps you know when you're going on vacation what you need to help pack to protect yourself, to protect your family.
And those maps are updated pretty frequently too, huh?
They're updated on a monthly basis.
Wonderful.
And we are also, because we have so many millions of data points now from these maps, we are actually able to start doing forecasting 1 month ahead. So we can do a parasite forecast for your county 1 month ahead. And it's on petdiseasealerts.org. That's our third website.
Excellent.
So,
no, go ahead, sir.
Yeah,
I'm sorry.
So if you're traveling somewhere and you want to say, I'm going to New London County, Connecticut, let's see what the risk is for Lyme next month. You can click on go to Pet Disease Alerts, click on the maps, and go look up what your risk is.
Yeah, and I'll go ahead and publish these links so the audience can check them out for themselves. It's really impressive stuff. Dr. Pryor, any final thoughts on the study itself?
I think this is an absolutely groundbreaking study because it's the first time when we can see that your pet is dog is a sentinel for the risk of human infection. I mean, this is just very, very groundbreaking, and it's going to really be beneficial to us as we move forward, looking at what risk assessment is and what we need to do. And so it's really just helping. It's a One Health message. It's helping protect people and families, and your pet is doing it for you.
And finally, let me give you a moment to talk about the work of the Companion Animal Parasite Council.
The Companion Animal Parasite Council is a national nonprofit. We are funded by industry, but we stay totally independent from industry. We are made up of practitioners like myself, parasitologists, public health veterinarians, and it's all about parasites and companion animals. We provide the guidelines that veterinarians follow. We provide information for pet owners. We do the prevalence maps. We also do forecasting. We do a national forecast for Lyme, Ehrlichia, Anaplasma, and heartworm in dogs. And then we do local forecasting 1 month ahead on the county basis for those same parasites as well. So it's a wonderful organization that just does a fantastic job with very, very little money and very little staff.
Yeah, I checked out the website, some incredible work going on there. And I want to thank you, Dr. Craig Pryor, for sharing your time and your expertise with us today.
My pleasure. Happy to.
And don't forget to check us out at the website, OutbreakNewsToday.com, the podcast, Outbreak News Interviews, which can be found on the website, on Apple Podcasts, Stitcher Radio, and Spotify, and the Outbreak News This Week radio show, which is aired Sundays at 1 p.m. Eastern Time in the Tampa Bay area on AM 1380 The Biz, or online streaming at 1380thebiz.com. And check out our social media presence, Facebook at Infectious Disease News, and Twitter at BacDman63.